Hi, Dr. Rao. Hi. So you're a urologist. You see a lot of patients. Are you also a surgeon as well? Do you do surgery?
That's right.
Okay. So you have prostate cancer patients coming out of the OR and back into your office, what, a month later, or how does that play out?
Typically, I'll see them back in about a week or less, take out their catheter, and
of
then
course.
review the results from the surgery and sort of go over how they're doing, obviously, make sure that they're healing pretty well.
Sure. And radiation oncologists will see their patients also over time, and time passes and such, and patients think like, okay, I'm now monitoring my PSA like my good doctor told me to, or told me to expect. I'm looking for a good nadir for radiation. I'm looking for 0, for surgery. If I'm doing any of the other treatments like HIFU or anything, I'm doing the best I can. Today we're talking about genetic testing. Is there any value for guys who have already had primary treatments, hopefully treatments that will be durable until they die at 120 from a heart attack? What is the point of doing yet another test, particularly genetic testing?
Sure, that's a great question. So the point of doing genetic testing is to sort of better understand what other risks may be associated with that patient who's in front of you. If urologists only look at PSA tests alone, they may be missing mutations which exist in that person who's in front of them. And the only clue we would have had to even consider doing genetic testing is the prostate cancer which was treated. So to give you a couple of examples. So, we have patients in our practice who had prostate cancer, had genetic testing done for the prostate cancer, and were found to have a BRCA mutation. That's a breast cancer mutation that most women and ovarian cancer, breast cancer patients are familiar with. Well, the patient in our practice actually developed a lump in his breast, and he had male breast cancer after having prostate cancer. And part of the reason we even found that was because of genetic testing. Another example, a patient of ours with prostate cancer had genetic testing, and they were found to have a predisposition to colon cancer. And it wasn't just a small risk of it. They had essentially 100% chance of developing colon cancer, and that was found based on doing genetic testing as well. And because of that, it leads to colonoscopies and sort of managing the colon cancer better and sort of preemptively rather than letting it declare itself, and hopefully providing better treatment outcomes to those people. Now, it's imperative that people understand that genetic testing isn't just for treatment, treatment targets with drugs trying to treat patients who have cancer, which is spread. It also sort of brings up the possibility that they're at risk for other types of disease processes or cancers. And those things could also be transmitted to their children or their other siblings that are DNA relatives of theirs. And I think that it's important that people understand how DNA works and how mutations would be passed on to their children, or maybe their brothers or sisters, or they may even come from their parents. And the easiest way to identify who has the mutation and who doesn't is to actually look in patients who have prostate cancer that sort of meet the criteria to have testing done, and try to uncover which mutations they might have.
Well, if it's looking and if it's discovering opportunities for other cancers to take my life and other diseases to impact my life, why isn't genetic testing why am I just now learning about it after surgery or radiation? Why didn't I start doing this, when I go for my annual physical and my doctor tells me I'm overweight?
That's right. So, to do massive genetic testing across the country on everybody is not currently recommended. You sort of need to have, in my opinion, expert guidelines to sort of provide a good to provide sort of guidance as to which patients should get testing and which patients shouldn't. We don't do PSA testing in 10-year-old boys, because there's no value in doing that. So you really need to be careful. Just because you have the ability to do a test, should you do that test? And that's where, you need to have a diagnosis of prostate cancer to even be eligible for genetic testing with your urologist. You can't just walk in the door with kidney stones and say, I want genetic testing for prostate cancer. That would not be appropriate.
So in a way, in a dark way, having prostate cancer opens the door to ways to save my life that I didn't even imagine. Is that fair to say? Yeah.
That's a good way of putting it. And also think about your loved ones, your brother, your sister, who may not even be aware that they might have a mutation, which you have, and you potentially finding something that they may or may not even be aware that they had. And because of that discovery, it leads to a treatment which prolongs their life. If you, as the patient with prostate cancer, can identify a mutation which your loved ones are exposed to, and subsequent to that, help them get that issue dealt with appropriately, or even do risk reduction to sort of help manage that potential for disease being present, being discovered earlier, I think that most people would strongly consider doing this testing. Sometimes it's easy to sort of go to the doctor's visit and just think about yourself, because that's the main reason that brings you in. But some men maybe never have even considered the implications of what this testing could do to help themselves, help their family, and help their loved ones. And I think if men thought about it in that capacity, more men would be interested in doing this testing.
Is genetic testing different for me now that I've had surgery or radiation compared to like somebody who's newly diagnosed or somebody who's metastatic?
No, it's the same genetic test that they would be eligible for. The difference is that, the genetic testing that I guess sort of the timing of it, the genetic testing for prostate cancer has not been around for years. So it's slowly being approved in various sort of disease states with prostate cancer. So although you may have had surgery, let's say 10 years ago, you currently may be eligible for a test that didn't even exist 10 years ago. This isn't just for new patients. This is for all of our patients with prostate cancer to consider.
Well, that's really cool. What is the test? I mean, what do I have to do for the test if I choose to do it?
Sure. So first thing is, your doctor will talk to you about the pros and cons of genetic testing. Secondly, it's either going to be a blood test or a saliva test should you decide that that's something that you want to pursue. It's a very simple blood draw, or it's a very simple saliva, it's literally spit into a tube type test that you could do depending on which company and which testing facilities are available to you.
And, I just had a shudder of paranoia. Is this going to upload my DNA to the dark web or any sort of impact on privacy for me?
It shouldn't. I think with anything these days, there's always that fear of having your information uploaded onto a dark web. Unfortunately, there's hospital systems and doctors' offices that get hacked, and these things could potentially happen. But in a perfect world, just because you have a genetic test, that information should not be made public to anybody. That's your personal health information.
So if in 10 years from now I see a clone of myself, I'll know what happened.
Well, I think in 10 years, if we see a clone of you, we'll be in a better place than we were 10 years before. So let's hope we can make that happen.
That's very sweet of you. And back at you, clone all of us. But, okay, so something for guys who have already been treated to consider. Worth a conversation with doctor, an email or a phone call, and see how it plays out. Thanks, Dr. Rao.
Thank you so much.